Hi, good morning. Welcome to Vcodemy. So this video, you will learn more about the anatomy and physiology of the heart and some of the conditions that affect the heart. The human heart is a muscular organ about the size of a fist, located in the middle of chest behind the breastbone. It contains four distinct chambers, two atria and two ventricles, a muscular wall called the septum, and four one-way valves that pump blood through the body. The septum is actually the wall separating the right side and the left side of the heart. Heart is the hardest working muscle in the human body. It never stops working. Coming to the heart chambers, as you can see in the picture, right atrium receives low oxygen blood from the body via large veins, superior and inferior vena cava, and then it pumps it down. This blood is received by the right ventricle. That is, so here you get the low oxygen blood, okay, and then it moves into the right ventricle. So from the right ventricle, the blood moves in, it is pumped into the pulmonary artery, which takes the blood to the lungs. So this is the septum, muscular wall separating both the left and right side of the heart. So once the blood is sufficiently oxygenated, it returns back to the heart. So this is received by the left atrium here. This receives the high oxygen blood returning from the lungs via the pulmonary vein. The blood is then pushed into the left ventricle, the largest, strongest chamber. This pumps the oxygen-rich blood to the rest of the body. So the pressure here is very high, and this is a very strong chamber, left ventricle. So keep that in mind. And there are valves. These are all one-way valves which do not allow the backflow of blood. Tricuspid valve sits between the right atrium and right ventricle. Tricuspid valve. Mitral bicuspid valve. This is between the left atrium and left ventricle. Pulmonary valve controls flow from the right ventricle into the pulmonary artery. Aortic valve controls flow from the left ventricle into the aorta. So how does the blood circulate in the body? So it starts in the heart. Blood circulation through the heart moves in a continuous loop. Deoxygenated blood enters the right side of the body. So the blood circulation through the heart moves in a continuous loop. Deoxygenated blood enters the right side from the body, travels to the lungs to pick up oxygen and returns to the left side of the heart to be pumped back out to the entire body. So the right side deoxygenated blood pathway. Vena cava, low oxygen blood from the body enters the right atrium through the superior and inferior vena cava. Right atrium, this top chamber squeezes the blood through the tricuspid valve. Right ventricle, this bottom chamber pumps the blood through the pulmonary valve. Pulmonary artery carries the low oxygen blood away to the lungs. So throughout our body, arteries carry only high oxygen blood. Veins carry low oxygenated blood. But this is the reverse case in the heart. Here the pulmonary artery carries the low oxygen blood away to the lungs. So that is an important point. So in the lungs, what happens? Gas exchange. Blood drops off carbon dioxide and picks up a fresh supply of oxygen. The left side of the heart is the oxygenated blood pathway. So, pulmonary veins, rich red oxygenated blood returns from the lungs into the left atrium. Left atrium squeezes the blood down through the mitral valve. Left ventricle, the thickest chamber, pumps oxygen-rich blood through the aortic valve. Aorta. So, as you can see the aorta here, which is the biggest artery in the body. The main artery distributes blood to the head, arms and rest of the body. So this is the heart circulation. Pulmonary circulation moves the blood between the heart and the lungs. So it transports the deoxygenated blood to the lungs to absorb oxygen and release carbon dioxide. The oxygenated blood then flows back to the heart. Systemic circulation moves blood between the heart and the rest of the body. It sends oxygenated blood out to the cells and returns the deoxygenated blood to the heart. So the circulatory and the respiratory systems work together to sustain the body with oxygen and to remove the carbon dioxide. Pulmonary circulation facilitates the process of external respiration. Deoxygenated blood flows into the lungs. It absorbs the oxygen from tiny air sacs, the alveoli, and releases the carbon dioxide to be exhaled. Systemic circulation facilitates internal respiration. Oxygenated blood flows into the capillaries through the rest of the body. The blood diffuses oxygen into the cells and absorbs the carbon dioxide. So now the question is, so many circulations. We are talking about the systemic circulation, heart circulation, pulmonary circulation. So what is the difference between these? So in the systemic loop, oxygenated blood is pumped from the left ventricle of the heart through the aorta, the largest artery in the body. The blood moves from the aorta through the systemic arteries, then to the arterioles and capillary beds that supply the body tissues. Here oxygen, nutrients are released and carbon dioxide and other waste substances are absorbed. Deoxygenated blood then moves from the capillary beds through venules into the systemic veins. The systemic veins feed into the inferior and superior vena cava, the largest veins in the body. The vena cava flow deoxygenated blood from to the right atrium of the heart. So you can see in the slide systemic circulation. This is the pulmonary circulation. Systemic is blood flows from the heart into the various body parts, whereas pulmonary circulation is blood flows from the heart to the lungs and from the lungs to the heart. So the path of the blood flow is left ventricle pumps clean oxygen rich blood out of the heart. Aorta receives the blood as the main and the largest artery in the body. Arteries and arterioles carry blood away from the heart into the smaller and smaller branching tubes. Capillaries, tiny thin vessels where blood drops off oxygen and nutrients to cells and picks up the carbon dioxide and waste. Venules and veins collect the used waste heavy blood and carry it back. Vena cava, the big veins, superior and inferior vena cava that dump the used blood into the right atrium of the heart. So nutrient and gas exchange feeds body tissues, removes the waste, blood flow control. Tiny vessels called arterioles open or close to send more blood where it is needed most. So like to your muscles when you are running or doing some exercise. So depending on the need. So you can see the systemic circulation. So in the systemic loop, what happens is the oxygenated blood is pumped from the left ventricle of the heart through the aorta throughout the body. So you will feel that how does the heart itself receive the fresh blood supply, oxygenated blood supply? It is through the coronary arteries. So you can see in the picture, there are branches which come out from the aorta, and they are called the coronary arteries. They supply blood to the heart muscle, because this is a very hard working muscle. Heart muscle needs constant blood supply. Okay, and the coronary arteries do the job. Coming to heart valves, the heart has four valves, four one-way valves, that is the tricuspid, pulmonary, mitral and aortic. These valves open and close with each heartbeat to keep the blood flowing in the correct direction and prevent the backflow. There is no reverse flow. The blood always moves in one direction. So tricuspid valve, located between the right atrium and the right ventricle. This has three leaflets. Pulmonary valve, located between the right ventricle and the pulmonary artery leading to the lungs. Mitral bicuspid valve, bicuspid is only two leaflets, so it's called bicuspid. Located between the left atrium and the left ventricle, has two leaflets. Aortic valve, located between the left ventricle and the aorta, sending the blood to the throughout the body. The heart chambers. The heart chambers are four hollow spaces within your heart. Upper chambers are called right atrium and left atrium. So lower chambers are called the right ventricle and left ventricle. The chambers work together to manage the heartbeat. They also send blood into the lungs to gain oxygen before recirculating throughout the body. Blood returning to the heart enters the atria and is then pumped into the ventricles. From the left ventricle, blood passes into the aorta and enters the systemic circulation. From the right ventricle, blood enters the pulmonary circulation via the pulmonary arteries. So, the interatrial septum. This is a solid muscular wall that separates the left and right atria. Atria is plural, atrium is singular. The septal walls in the right atrium is marked by a small oval-shaped depression called the fossa ovalis. This is the remnant of the foramen ovale in the fetal heart, which allows right to left shunting of blood to bypass the lungs. It closes once the newborn takes its first breath. An atrial septal defect is an abnormal opening in the interatrial septum, persistent after the birth. The most common site is the foramen ovale, and this is known as a patent foramen ovale. It has to close at birth, it doesn't close. So in the adult, left atrial pressure is usually greater than that of the right atrium, so blood is shunted through the opening from left to right. In large septal defect, this can cause right ventricular overload, leading to pulmonary hypertension, right ventricular hypertrophy, and ultimately right heart failure. The left atrium receives oxygenated blood from the four pulmonary veins and pumps it through the left atrioventricular orifice guarded by the mitral valve into the left ventricle. Interventricular septum. The interventricular septum separates the two ventricles and is composed of superior membranous part and an inferior muscular part. The muscular part forms the majority of the septum and is the same thickness as the left ventricle wall. The membranous part is thinner and part of the fibrous skeleton of the heart. Left ventricle receives oxygenated blood from the left atrium and pumps it through the aortic orifice guarded by the aortic valve into the aorta. Tetralogy of Fallot is a cyanotic congenital heart disease comprising four abnormalities as a result of the single development defect. The four abnormalities are ventricular septal defect, overriding aorta. This is where the aorta is positioned directly over the VSD. VSD is ventricular septal defect, pulmonary valve stenosis, right ventricular hypertrophy. So here in this slide, looking at the aorta, this is the main and the largest artery in the human body. It starts at the left ventricle of the heart, arches up through the chest and goes down through the abdomen. It carries oxygen-rich blood to all parts of the body. So you have thoracic aorta, then you have the abdominal aorta. Okay. Sections of the aorta are aortic root, the start point attached to the heart. That is the aortic root. It holds the aortic valve. Ascending aorta, the short part going up. It sends blood to the heart muscle via the coronary arteries. Aortic arch is a curved top part. It sends branches to the head, neck and arms. Descending thoracic aorta, the part going down through the chest. Abdominal aorta, the lower part in the belly. It feeds the lower body and the organs in the extremities. So some of the common health issues which can affect the aorta are aneurysm, aortic aneurysm, a weak spot in the artery that bulges out like a balloon. Dissection, a dangerous tear in the inner layer of the wall of the artery. Atherosclerosis of the artery, hardening or clogging of the artery from fat buildup. So these are some of the common health issues affecting the aorta. So we have seen this before, tetralogy of Fallot. This is a rare congenital heart defect present at birth, consisting of 4 structural abnormalities: a ventricular septal defect, hole in the heart wall, pulmonary stenosis, narrowed pulmonary valve, an overriding aorta that is shifted main artery. The position is different, and right ventricular hypertrophy, thickened heart muscle. It restricts the blood flow to the lungs, causing low oxygen bloods and blue skin cyanosis. So this syndrome usually has the 4 heart defects: VSD, ventricular septal defect, a hole between the heart's lower chambers, allows oxygen poor and oxygen rich blood to mix, which shouldn't happen. Pulmonary stenosis, a narrowed valve and pathway reduce blood flow from the heart to the lungs. Overriding aorta, the body's main artery shifts over the VSD, receiving oxygen poor blood from both the ventricles. Right ventricular hypertrophy, the muscle of the lower right chamber thickens from working too hard. So the symptoms are cyanosis, blue or gray tint to the skin, lips, nail beds, tet spells, that is sudden drops in the blood oxygen, causing extreme blueness, fussiness or loss of consciousness. So this can be surgically corrected. So coronary arteries, these are the main arteries which supply the blood to the muscle, heart muscle. They are the vital blood vessels that wrap around the outside of the heart. They branch off the main aorta to deliver fresh oxygen rich blood directly to the heart muscle, so it can pump properly. Main anatomy: right coronary artery RCA feeds the right side of the heart and the parts that control the heartbeat rhythm. Left main coronary artery LMCA splits into major pathways feeding the front and the left side of the heart. Left anterior descending LAD supplies blood to the front and the middle of the heart. Circumflex artery wraps around the back and the outer side of the heart. If any of these arteries have a clot or fat, atherosclerosis, that is fat buildup, and so they become narrowed, the lumen inside the artery is narrowed and the blood doesn't move, the patient will have a heart attack. The heart muscle will start to die. So if these arteries are blocked, there is a procedure which is called CABG, coronary artery bypass grafting. So this is a surgical procedure, major operation, which is done to clear the artery or bypass the clot, the diseased artery. So doctors use a healthy blood vessel from another part of the body to make a new path around the blocked artery in the heart. So this is why it's called bypass, and the graft is taken from one of the veins. This lets the blood and oxygen flow to the heart muscle again. Why is it done? To treat the severe coronary artery disease, CAD, to stop the chest pain, it's called angina, to lower the chance of a heart attack. How the surgery works? Usually surgeons take a healthy blood vessel from the chest or leg or arm. Frequently used is the saphenous vein from the leg. This is a blood vessel conduit for the coronary artery bypass grafting, CABG. Surgeons use it because it is plentiful, long, easy to remove, flexible enough to reach the multiple blocked coronary arteries. So when you're coding, you should note down how many grafts are used, which is taken from the graft is taken from which body part. If it is the saphenous vein, how many vein grafts are used and how many artery grafts are also used. So why the saphenous veins are preferred is they are abundant length, easily harvested from the leg to bypass multiple blockage sites. Versatility, that is, they can connect the aorta to almost any coronary artery branch. Very flexible. Technically very simple, so straightforward for surgical teams to handle and stitch with. So they attach it above and below the blocked part of the artery. The operation takes 3 to 6 hours. It can be done with the heart stopped using a heart-lung machine or while the heart still beats. This is called off pump. Okay. So here you can see the coronary artery blocked with fat here. So this is a graft, bypass graft, and this is a vein graft. Some of the interesting heart facts. So heart beats around 1 lakh times each day. It is the strongest muscle, hardest, hard-working muscle in the body. Has its own electrical supply. Pumps up to 7,500 liters of blood each day through over 95,000 kilometers of blood vessels. It makes a beating sound from its valves opening, closing. It's kept healthy by nutritious food, exercise, and laughter. So I hope this video was useful to you and it was informative too. For any more doubts, please contact Vcodemy Medical Coding Training. You can call us at 9944478988 or email vijayarani.s@vcodemy.com. Thank you for watching.